My name is Dr. Sarah, and I'm one of the doctors working in this clinic. May I
Mhm.
confirm your name and age, please?
Yes, sure, doctor. My name is Smith, and I'm 24 years old.
Okay, Mr. Smith. May I know what brought you here today?
Yes, doctor. Actually, from the last 3 months, I've been experiencing these headaches specifically on the left side of my head. And
Okay.
there is a lot of pain I cannot describe. And I took some medications as well, but they are ineffective. So that's why I'm here. I think that I might be having tumor.
Okay, Mr. Smith. Mr. Smith, so sorry to hear about your situation. Do you mind if I ask you a few questions?
Yes, sure, doctor.
Complaint? Okay, Mr. Smith, can you please tell me that uh, these headaches are what is the duration of the headache, or is there any specific time at which?
No, doctor, I have not noticed any specific time. But from last 3 months, they are there, and I'm feeling, nausea as well. I have taken the paracetamol, and it is not working for me. Okay, but I do have noticed one thing that it they tend to increase when I drink red wine. This is something which I've noticed.
Okay, Mr. Do you mind if you please tell me that is there any specific area of your head?
Yes, doctor. As I mentioned earlier, it
Over your
is.
head.
Yeah, yeah. Yes, doctor. As I mentioned earlier, uh, it is
Okay.
on the left side of my head, and specifically at the
Okay.
temple area. Okay, and it
Okay.
is quite painful. And actually, my mother died 10 years ago, and she also was having the similar kind of headaches. And that is the reason I'm concerned that it might be a tumor.
Okay. Okay, Mr. Smith, I would like to tell you that we need to do a full neurological examination of yours for checking any signs of any neurological disease. Is that okay with you, Mr. Smith?
Yes, doctor.
Okay, Mr. Smith, I would like to tell you that after the examination and after your history, I would say that most likely this headache is migraine. And I would I would like to tell you that the you are taking the red wine which you are drinking is the most likely cause of the most likely triggering cause of this headache, Mr. Smith. Are
Yes,
you following me, Mr. Smith?
Yes, doctor, I'm following you, but I would like to know the treatment. As I mentioned, my mother was also taking some barbiturates medication, if I'm not wrong,
Okay.
and they were really
O-
helpful. And so I just want to know if I can get the same medication so that I can feel better.
Okay, Mr. Smith, I'm sorry to tell you that these medications are habit forming medications, and these medications are not recommended nowadays. But I can tell you some preventive and as well as abortive treatment for migraine management. So they will be very helpful for you, Mr. Smith. Is that okay with you, Mr. Smith?
Yes, doctor, that's fine.
Okay, you can as far as the preventive management is concerned, you should sleep regularly, eat regularly, and exercise regularly. And I can give you some abortive medications which will help you in relieving your migraine symptoms. Is that okay with you, Mr. Smith?
Yes, doctor, that's fine.
Okay, Mr. Smith, do you have any other questions regarding your complaint, Mr. Smith?
No, doctor. Thank you so much.
Okay. Okay, please take my card. I will be available at any time. If you feel any questions, you can ask me anytime. Thank you, Mr. Smith.
Okay, thank you, Dr. Sarah. Okay.
Okay.
The good thing is, Dr. Sarah, I hope you have also noticed that the flow is better now. Okay, the
Okay.
fluency is there. Okay,
Yes, sir.
definitely there are few things that we have to improve. I will be talking about those as well.
Okay.
And a very, a quick overview. See, from the very, let's just break down the card. Okay, now the first thing, if you remember, I have discussed that I am concerned about these headaches, and my mother died 10 years ago.
Yes.
The whole card,
Yeah,
when
I
you were
have to know.
listening to me, you forgot
Yes.
to talk about that,
Yeah,
right?
forgot. Yes, yes,
Yeah,
yes.
because my main concern was about the
Yes.
tumor, right?
Yes.
Because I was asking
Yes.
you that I might be having tumor. I was not concerned about headaches at all. My main concern was
Yes, sir.
tumor because my mother died 10 years ago. And if I'm having the tumor or not, I have taken the medication, they were not working. And therefore, I was thinking that it could be a tumor. Never skip the patient's concerns. Yeah. If you'll skip those, eventually, whatever you speak, that doesn't matter. Why? Because they will think that, you guys are unable to listen to the patient properly. And if you're not listening, that it means you don't understand the English language. Okay. And if you're not listening properly, then definitely you're not going to answer properly. And if you're not answering properly, then your card is not completed. That was important. The other thing about you asked me about the location. That's fine. You can ask the location, but remember, if patient has already told you, then that particular question is
Hmm.
gone, right? If I
Okay.
have said left side of my head, now where is the headache? This question is gone because I've already said
Okay.
left side. It means if you're asking me the same question, whether you have not understood my point at the first or whether you were not
Hmm.
paying attention to that. Okay.
Okay.
Remember, listen well so that you can answer your patient well. Okay. This will
Yes.
help you in lab 2 and this will help you in OET. Okay.
Yes, sir.
Lab 2 is all about interpersonal skills. Okay. And interpersonal skills are all about listening the patient, addressing the concerns. Same goes for the OET. Listening the patients, addressing the concern. If you're not doing that, card is not clear. Okay.
Okay, sir.
The third thing. Now I said, that I am worried and this and that. The good
Hmm.
thing was that you replied to me that you understood everything, okay, and this and that. That was okay. There's no problem with that.
Okay.
And at the end, about the barbiturates, okay,
Yes.
about the barbiturates, it's fine to say that they are habit forming, but you can just increase some of the words because see, you just have
Okay.
3 tasks and you have to
They're
complete five.
dependent.
Yeah, you have to complete your card within 5 minutes. There should be no silence, awkward silence. Okay, so you have to say
Okay.
something. So just try to enhance the few lines if the card is shorter. Right now they are not giving the short cards. The cards are quite lengthy. This one is quite old card, so I have sent here because definitely we do not have a lot of time so that we can have gigantic cards over here. Okay.
Okay.
So the other thing, this is not the pronunciation was fine, but I would prefer to say migraine rather than migraine.
Okay.
Okay, yeah, because
Migraine.
you can
Okay.
yeah, migraine would be better. Okay, migraine I have
Okay.
no problem with it, but it would be better if you could say migraine. Yeah.
Okay.
So these are few important things that I thought I should mention. Okay, and rest of the things are fine. The flow is there. I hope you have noticed that things have improved. Uh,
Yes. Yes, sir.
so yeah, pretty much going well. Okay, inshallah, within few more days, we are going to get done with the fluency part. Sorry, with these few minor mistakes as well. Okay, but do not make
Inshallah,
those
sir, inshallah.
over and over again. Okay.
Yes, sir. I will try my best.